I'm Patty Copal, and I'm the Director of Member Networking and Learning. Thank you for joining us today for this exciting session about community health needs assessments hosted by our Health Funders Group. We have a great session planned for today. I want to give a shout out before we move any further to Valerie Liggins and Denny Huff, our co-chairs, and to Angie Molina for their help in planning and hosting today's conversation. It's always more time consuming than we want to admit for putting these Zooms together, and we couldn't do it without our co-chairs and our capable colleagues. So very briefly, for those of you who may be new to these events, VFN's membership has grown to 110 grant-making organizations from every region of the Commonwealth. And as you've likely experienced, if you have joined us for any of these, is many of our learning sessions have focused on hearing from subject matter experts and then having a group Q&A. Today, we're going to try something just slightly different. We've got some wonderful CHNA technical information to share. And we're going to have Q&A time with our experts, but then we're also saving ample time to hear from you about the work you're doing in this area, recognizing that your experiences are another level of expertise. Listening to and sharing with each other strengthens our connected, trusted, and collaborative philanthropic network. So with that, I'm going to turn it over to Denny and Valerie to get things started.
Thanks, Patty. We're excited to have everyone here. Thank you all so much for joining us. Hopefully you can hear me pretty well. Sometimes my microphone doesn't pick up that great, but at any rate, thank you all so much for joining us. This is really exciting topic for me personally, and hopefully for you guys as well. We all know the difficulties in getting the right kinds of data to look at in our communities to make sure that we are making the right funding decisions and building the right collaboratives and so forth. And utilization of your community's community health needs assessment is one of the great ways to do that. The data that it provides and working with your local health system as well to work on those issues is been a wonderful way to build the collaboratives, build sort of community investment, which is what it really takes to transform a community, is everyone invested in that purpose. So we're really appreciative of you guys joining us. We're really grateful for our two speakers that we have, and I'll introduce those folks. First, we have Khalida Willoughby. Khalida is the Community Health Improvement Manager at the Virginia Department of Health. In that role, she oversees the State Health Assessment and State Health Improvement Plan. Prior to serving in this role, she was the Population Health Improvement Trainer in the Division of Population Health Data. Khalida is a veteran. Thank you for your service, Khalida. Having served in the United States Navy, she holds a BS in Public Health and an MS in Health Education. She resides in Chesterfield County with her husband and 3 daughters. Khalida, thank you so much for joining us today. We also have Pat Young with us. Excuse me. Pat's a graduate of Virginia Tech, has a bachelor's of science in biology and a master's in human nutrition, foods, and exercise. She is a medical technologist and dietitian. Pat has served as the director of community health at Centra, or is serving as the director of community health at Centra. During that time, she has led the 2021 Community Health Needs Assessment and the 2022 through 2025 implementation plans for Centra's service region, as well as Centra's community grants and sponsorships. Prior to coming to Centra, she served 15 years as a consultant to communities across the Mid-Atlantic and Southern states as the owner of Community Works. In addition, she led the United Way Roanoke Valley's Healthy Roanoke Valley, a partnership of cross-sector leaders that focused on improving health and vibrancy of the Roanoke community by addressing the social determinants of health, which we'll be talking about as well. She's worked to increase access to health and human services for underserved populations through community and strategic planning, coalition building, successful fundraising, and grant writing campaigns, the implementation of comprehensive services initiatives. So thank you, Pat, for joining us well, and both of you for your expertise you're about to lend us. And Valerie Liggins of the Cameron Foundation, my fearless leader here on the health networking team, will be the most capable moderator for this session. So Valerie, I'll turn it over to you.
Thank you, Denny. Thank you, everyone. So hopefully everyone can hear me as well. I am very excited about this topic because a lot like most of you, I am in the middle of doing an update to our 2018 Health Needs Assessment. So when this topic came up, I don't think you could have dynamited me out of not presenting on this topic because we're in the thick of it. I was also come full circle as well because Khalida and I worked on our 2018 Health Needs Assessment together. So, you know, how beautiful is that to find out that she is in the role that she is in and is getting ready to share some awesome news that I think most of us who do this work will be very excited about. So we will start out with Khalida, who will share the work about the work that she is doing. We'll have time for some question and answer, just a brief amount of time. What we're going to ask you as well is to drop your questions into the chat and Slido, not tech savvy. So Angie may have to jump in and kind of show us about Slido a little bit, but definitely drop your questions in the chat. The chat will be monitored not only by myself and Denny, but also by the staff of VDH as well that is here with Khalida. And then after Khalida, we will hear from Pat. And so we'll start out with Khalida first so she can share her news with us. Thank you.
Thank you, Ms. Valerie, and it's nice to come full circle and connect with you again. It's been wonderful. Good afternoon, everyone. I'm Khalida. I work at VDH. I am in the Center for Community Health Improvement. So this is a new center to VDH. We've been in existence since December, so actually really technically January of 2022. And just the center was stood up because during the COVID-19 pandemic, we just, it really underscored the importance of using data and partnering with our communities to improve health and to really reach folks in our community. So the Center for Community Health Improvement, one of our aims is to do that. So we coordinate with different offices here within VDH, but then also with our community partners to ensure that we're addressing the needs of the community and we're collaborating to improve upon community health. So one of our main functions here within the CCHI is to provide technical assistance to our local health districts, as well as our community partners on the completion of their CHAs and the CHNAs. So my counterparts, Brianne and Jada, are joining us today, and they work with the local health districts and community partners. So as you guys go through your CHNAs, if you have any questions, you need help with developing surveys, figuring out sample size, things like that, we're here to help. We also have a newly developed Center for Public Health Informatics that helps with the informatics to complement the work that we do on the community health side. And then we also have a new division within population health data, which is called the Community Health Epidemiology Program. So really supporting all of this good work that all of us are doing, not only for assessments, but then monitoring our improvement planning as well. So our community health assessment is just really a process of understanding our communities. So really identifying and analyzing community health needs, the assets within communities, and then thinking through how we prioritize those needs and develop a plan to either grow on certain programs or services maybe that are already in the community, or use evidence-based tools or resources to help improve on health. So I like to tell people, you know, community health needs assessment isn't only about the needs, but sometimes it's about expanding upon the assets that we already have. So not reinventing the wheel. So like I said in the past, my team and Jada so myself, Jada, and Brianne would work with the local health districts to complete community health assessments. So what we realized is that a lot of the heavy lift was in the data portion of completing these assessments. So in the hospitals and the local health departments, that took a lot of time and energy and sometimes resources. So be that in the way of funding, because a lot of hospitals had a contract out because in-house they didn't have, the skills or the resources or someone that has the skills to complete these assessments. And the same was true across the local health districts. So in 2018, we developed what's called, well, Dr. Oliver at the time, and then the head of VHHA stood up the Partnering for a Healthy Virginia. So one of the work groups from that is called the PHV Impact Collaborative, and that's a collaborative of healthcare, of hospitals, and public health. So really one of our main goals was to encourage that public health and the hospitals work together to complete their community health assessments. And this need was also brought here that, hey, like the data is a heavy lift and we don't really have the resources to be able to do this every 3 years or every 5 years. So we thought, hey, well, why don't we do some research and figure out what portals are out there that can help us help us with providing this resource to our partners. And so VHHA took a look at all the community health needs assessments that had been complete from about 2014 to 2016. They pulled out all the common indicators, and then we sort of went through those indicators, matched it with the state health assessment indicators, and then also looked at what geography indicators were available with. And we came up with a first list of indicators for the development of what we currently call the Virginia CARES portal. So I will go ahead and share my screen. So the moment you've all been waiting for, are you guys able to see the screen? Okay, perfect. So this is our the Virginia Local Health Assessment Tool, what we're currently calling the CARES portal. This site isn't live, but very close to being live, so you can expect to start using this in like the next week or so. It's open and available to anyone who would like to use it. And we hope so. We started with that list of 100 indicators, and we hope to build upon this. So we'll start our second year build in the next month or so and add additional indicators. So there are two main components of the CARES data portal. There's the local assessment tool, and then we have a Virginia map room. The local assessment tool is where you go to basically build a community health assessment. So at the top of the screen here, you can click from there to access it. Here, if you hover over, you'll see the assessment data list. If you click on that, that pulls up all the indicators that are available in the local health assessment tool, the source geography, the state benchmark if available, any supplemental data, and then if zip code level data is available. One really neat thing that we're very proud of here at VDH is we wanted to have timely data. So we're feasible, which is for most of the indicators, they're at least 2020 data. So, and as time goes on, we'll make sure that those are updated as the data becomes available real time. So there shouldn't be a lag. So you shouldn't have like 2016 data in your 2020 chart is the hope. So I'll click back on that local assessment tool. And then because I live in Chesterfield, I will just select Chesterfield as our locality. So how we have it broken down is you could select various ways. You can click on a locality list and it lists all of our localities in Virginia. You're able to select more than one locality, so you can just click through your counties. So for those hospital service areas that are in multiple counties or areas, you're able to just click through whatever you want in this list. You can also click by local health districts, which we have 35 in Virginia. You can select by a health region. You can draw your own locality or you can pick from a map. So say if you were interested in a certain zip code, you can pick from the map of that. Just you won't find, if you do it by zip code, obviously that's going to limit the number of data indicators that are included in the report. So I'll just choose Chesterfield County as our assessment location, and then all you do is hit data indicators. So here you see the various categories of our data. You're able to select all, or if you're just interested in one or two indicators in one or two areas, you can select that as well. For purposes of this demonstration, I'll go ahead and select all the indicators, and then all you do is hit report. And it generates a community health assessment report for you. So at the top here, you'll see the location, and it'll let you know what counties you chose. If you chose more than one location, those will all be listed here. And then you'll see the data. So there's always going to be a stem sentence sort of above each of the tables. Where available, you'll see that we have a map. So if it's anything that could be mapped, you're able to view that, and you have the option to view a larger map, which I'll go through that later. The way we built the report is that under here, you'll see the county or the localities that you selected. You'll also see the health district within which that locality is. And then you'll see the rate for Virginia and United States so that you're able to compare. And then underneath the tables, you'll see, if you click on it, you'll see the data source. So for here, it's the Census American Community Survey. If you click on that, it'll take you to the ACS page if you wanted additional information. You can also click here to see additional information about the background on the data, the methodology, any notes, and any limitations to the data. Where feasible and where available, data will be broken down by gender, race, ethnicity, if it's available, and sex. In the future, we'll hope to add income to that as well. And then if you scroll down, you're able to hover over the data. You're able to click on and off. So say if you didn't want to see, well, this isn't working for this one, I'll maybe pick. So say, for example, you just wanted the Chesterfield rate, but not Virginia or the United States, you're able to click through that and turn those off and on as well. This menu is called the hamburger menu, as the folks at CARES called it. You're able to just scroll through the indicators. So say, for example, if you're just interested in asthma hospitalizations, you can click down to that and see what that data is. So this is one of those areas where we've worked internally to make sure that we have the most recent data that's available internal to VDH and not from some of the national sources. And so you'll see that listed on here, VDH, and then that it comes from VHI and that the data was directly obtained from us in the data year. You'll see here over to the right, you have this indicator that tells you if you're better or worse than the state. So Chesterfield County hospitalization rates for asthma is higher than the Virginia state average, and then also higher than the local health district rate. And that'll also be captured over here in this dashboard indicator, windshield wiper indicator, I'll say. And so obviously the red means that it's worse. And so we're available. So I said 2020, the most recent, but we'll also, you'll also get a trend of data. So it's more than one or two data years in here. So you could see how that data is trending within the geography that you have selected. And then the neat part about this the portal is that you're then able to download. So we know that when we do assessments, there's a survey component, or maybe you might want to give a little bit of background about your hospital or your organization. You have the option to download this report in a couple of ways. So you're able to download it as a PDF. You can download just the data in an Excel table, or you're able to download the report in a Microsoft Word document, so that then you then have the functionality to come back and like maybe edit some things, add additional context, include results from your survey in the portal. You also have the option to just share the link with someone, or to share the link on social media. And then you have the option to print the report as well. So those are the main functionalities of the data portal. Now I'm going to show you the map room. So there's two ways in which you can access the map room. So similar to the local assessment tool, if you hover, you can click on the map data list, and it tells you, it'll give you, there's this nice infographic at the top that tells you how many layers there are that you can add to the map, how many data items are in the map, the number of data sets, and then the number of data providers. So my apologies, this page, I shouldn't have loaded this page because there's so much information. So it loads really slowly, but there's like school data included, crime data. Soon I'll show you there's like information on like substance abuse treatment centers. So you have the ability to, basically the sky's the limit. You can do as much or as little as you want in the Virginia map room. So I will click on that. Sorry, my computer has frozen, of course. I guess in the meantime, I'll see if there's any questions that I can answer.
Khalida, I can tell you a lot of people are very excited. And one of the questions is, when will the site go live? And my question is, what types of marketing will be done to kind of let people know it's live?
Okay. So the site will go live. It's done. We're just doing like final QA checks. And I think I need to stop going in it and our team, because every time I go in, I'm like, oh, I feel like I see one more thing, another thing that needs to be edited. So really, we're beta testing this week. So technically it's out there. We've selected some folks from the PHV collaborative. So some coordinators from hospitals and some local health district folks that are going through and doing a beta test of the portal. That will end this week. So hopefully anytime like next week, it'll go live.
And another question is, will you be able to choose multiple zip codes when using this
So
tool?
in the function at the top of the local assessment tool, you can. So you can either draw or you can pick from a map, and you're able to pick multiple zip codes. Again, some of the data that we provided internally are not available on the zip code level. So you may see like no data when you do your report for a couple of the indicators. I was in the map room and then I clicked out, sorry.
But definitely, I think anyone who's done community health needs assessment, to be able to have this information at your fingertips is extremely exciting. And so a lot of people are very excited about the potential of this tool. Now, when you and I were talking, you did share that this is a grant-funded tool, or can you tell us a little bit about that while you're navigating?
Yes, ma'am. I think we're up. Are you guys able to see the
Oh,
map?
if you're up, then you can.
Yes, now I can answer that really quickly, Ms. Valerie. So yes, this is grant funding. However, we know the value. And so at least for like, it'll be here right now, at least for 3 years. And then we're definitely talking about sustaining this long term because we do realize, the value in this. And like some of the things we're working with the Center for Public Health Informatics to automate. And so the cost for this portal is compared to other products that aren't as intuitive and as like user friendly as this. It's because it's through University of Missouri and that's like a higher ed institute. Some of that the care center is like federally funded, so the cost for them to build this is actually very, very reasonable. The site does run, it's very quick, so you won't have, I'm in the office today and our internet is very slow in here. So when you're using this elsewhere, it shouldn't be this slow. So here's the map room. Every time you come in, you'll see the state. You can zoom in, so either by scrolling or selecting an area, or you can also enter a location here. So I'll go ahead and do Chesterfield. And then you can click add data. So say you wanted to see asthma. And so when you search, it's best to just be as like simple as possible with the way you search. So that pulls up more options for you. So you will see here all the data they have relating to asthma and then like the year. So and you could do a couple. So we could do children 0 to 7 with asthma by state, and then we can also do adults diagnosed with asthma. Oh, zoom out a little bit. So then that'll pull up that data. You could play with the transparency here. You can also just do, there's a legend here, and then you can also just do labels. I like doing labels because it just helps you see more the rate. Yeah, so you can see, and then if you hover over, it'll also pull up a box with the data information for you. Say you wanted to, so here you go, and it kind of gives you a background of the data too. Up here, you could switch the layer. So this is adults, and then we'll do children with asthma. You can also add, so say you want to do median income and see asthma rates based on median income by county. You can do that as well. And then you would have to play with the transparency so you could see all 3 on the map, but you can also, again, just add that label to that. And then you can hover. So now you're seeing asthma hospitalization rates in kids, adults, and then the median income in that area. I'll go ahead and clear the map. Say you wanted to search substance abuse treatment. So you can see opioid treatment services. You can add that to the map, and then that will pull up different areas where that is available. And then if you hover over, it'll give you the name of the facility, their phone number, and then a website if they have it, so that you're able to have that contact information as well. So say, for example, someone was writing for a grant, they could potentially say, let me look up the opioid overdose rates for Chesterfield County, and let me layer that with the number of treatment providers there are in the county, and that would generate on this map. So that's it for the mapping tool and the local assessment tool. To answer the question you asked previously, Ms. Valerie, we are working on a press release for when the data portal goes live. We're having various training opportunities. So we're actually having the folks at CARES. It's an hour training that's very detailed. The next one is on Thursday. I'll have Amanda share the link with you, Ms. Valerie, if you want to send it out to the group so that anyone who wants to get more insight on using the tool, they're able to join that. Jamie from CARES is 50 times better presenting this tool than I am. So we're doing that, and then we'll have additional training sessions and hopefully reach out to our community partners to let them know that this tool is available and they're able to use it to their heart's content. So we want people to use it as much as possible so that we could show the value in having this.
Oh, that sounds wonderful. So, again, I think everyone's excited at the possibility, definitely for 3 years at least. And I'm sure you can prove the sustainability of this tool, but at least for 3 years, we have it to really, really dive in. Does anyone have any last questions before we move to our next speaker, which is Pat Young? Any questions? You can come off mute or you can place in chat, whichever way you're comfortable. Okay, so hearing no questions, our next speaker is Pat Young, who's been introduced. We're really excited to have Pat speak to us because, as you can see, we've had Khalida talk about the tool and being able to access data. Pat is going to tell us how they actually utilize the process of going through the community health needs assessment and what their process is in their locality, what has worked really well for them. And also, just like with Khalida, if you have any questions, please put it in the chat. And we are all monitoring the chat to make sure your questions are answered. And so, Pat, if you're ready.
I am. Can you see my screen?
My
slides?
I think, Khalida, you may have to stop sharing. Yep, there we go. We can see your screen now. Thank you.
Great. Thank you. Well, good afternoon, everyone. And I, being a lover of data myself, I am so excited about this tool. I was fortunate to be, I'm part of the Partnering for Healthy Virginia committee as well. And so it's really great to see this come to fruition and talk about not only a time saver, but a money saver for many of us who have to contract with people to collect this kind of data. So Khalida, thank you so much. I'm really excited to learn more. Again, I'm Pat Young. I'm the Senior Director of Community Health at Centra. I've been in this role since October of 2020. So I came in during the height of the pandemic. Centra, for those of you that don't know, we're headquartered in Lynchburg, Virginia. We are a health system of 4 hospitals in 3 service regions. We serve 12 counties, 2 towns, the town of Bedford and the town of Farmville, and of course the city of Lynchburg, and about 450,000 citizens in our service area. We have a new leader who started a year ago in September, Amy Carrier, and under her leadership, we have just finished a strategic plan, and I am super excited about it and wanted to share just a couple of pieces of it with you because it has community written all over it. And for those of us in this work, that's what we want to see. We want to see the support of our health system. So our new mission statement is to improve the health and quality of life for the communities that we serve. And then if you look at some of our strategic themes, there are 5 altogether, but one of them is community health and value-based care. And under that tenet, it talks about how the health system is going to align with the community health needs assessment work. So we went from a system that didn't even have a department of community health 3 years ago to now having full commitment with our leadership from the board of directors on down. So I'm really fortunate and grateful to be sitting in this chair. Most importantly, our work is driven by trying to achieve health equity. I never present without reminding everybody that's why we're here. And we're here to give everyone, each individual we serve, the tools they need to live a healthier, more productive life. So who are we, Community Health Services? We are definitely the people that do 3 needs assessments every 3 years for our health systems. And then we help foster and implement plans that address the needs that we identify in our needs assessments. But we're also responsible for community benefit. So like many of you, we're grant makers. This year alone, we will grant about $1.5 million in grants to our 3 service regions. In addition, we are responsible for all of the sponsorships across our region. And so we invest about $400,000 a year in sponsorships across our 3 service regions. In addition to that, we are responsible for tracking community benefit, which is an IRS requirement, as is the CHNA and the implementation plans. And so every year we are responsible for what's called the Schedule H on our IRS 990, Form 990. And annually, starting this year, we will be publishing a community impact report so that we can start to tell the story of those that in our communities who are making a difference, and how our investments and the work that we are doing both as a health system and as a community partner are making a difference. My favorite part of who we are is kind of the more fluffy piece of it, but the most important part, and that is that we are addressing health equity and social determinants of health every day. We are sitting at the table in many regional partnerships and coalitions that address social determinants of health. In addition, we are piloting, for those of you who have heard of it, we are piloting the Unite Virginia closed loop social determinants of health referral system. This is a pilot that is supported by the Virginia Hospital and Healthcare Association and the Virginia Department of Health. And we are hoping to have this referral system integrated within our EHR and also implemented across our region in the next 3 years. So there's a lot of work underway right now to provide that single point of entry for many people who require multiple services across our region. And then finally, something that we're working on, trying to figure out where there's some grant money or there's some collaboration around developing a team of community health workers. I truly believe that the only way we're going to make a difference in our communities is to have boots on the ground and to have individuals who represent the communities that they serve and can be a true connector and advocate for those that are most vulnerable. So I actually did the 2018 Community Health Needs Assessment for Centra as a consultant. And so in 2021, I actually came in as a member of the team. I mentioned earlier that our department is young, just developed in January of 2020. Beforehand, this work was not institutionalized in our health system at all. As I said, I was hired as a consultant in 2018. We hired multiple companies over the years to do our assessments and did not really have any standardization or any way to really compare apples to apples every 3 years. So now, again, we have very strong commitment from our Centra leadership to institutionalize this work. And I mean, I'm telling you, this new VDH tool is really going to make our life a lot easier and allow us to do deeper dives on data much quicker than we are doing right now. So just as a reminder, again, this is kind of what the IRS requires of us to do as a nonprofit health system in terms of community health needs assessments. you know, there is a federal register that is about 58 pages long. If you haven't read it, that gets into the IRS requirements for needs assessments and implementation plans for nonprofit hospitals. But really the most important things are from a community perspective, that we define the community that we serve, and we do that by looking at hospital discharge rates so that we can look at where people live in the hospital, in the regions that our hospitals serve. We are extremely dedicated to including our community partners and our residents in the actual assessment. And we do that through community health surveys. We do it through focus groups. And we have a team for each of our hospitals of stakeholders who actually at the end of our assessment period are the ones who are prioritizing the needs for the next 3 years. In addition, we have our CHNA available on our website, and I do have that website to share with you, but you're welcome to go back and look at the last 3 to 4 years of needs assessments for the Centra area. Again, I said we do three assessments every year. It's hard to believe. It feels like we just finished 2021 and we're already talking about 2024. But we define our target population across all 3 regions as those who are medically underserved, low income or minority populations, and those suffering from chronic disease. So that really encompasses a great deal of our population. Obviously, we're driven by the geographic area that's served by each of our hospitals, and where appropriate, and in particular in our Lynchburg region, we look at targeted populations served by our Pearson Cancer Center, our women's and children's services, and also our geriatric population. Our needs assessments are about 270 pages long. So if you want to curl up and really look at some data around in Central Virginia, and I encourage you to do it. We like to say that we're lifting the voice of the community with our assessments. We actually, the data that we collect through our community health surveys and our focus groups, it is the data that we call our primary data, because that data is used to help us with decision making. And we use the publicly available data that Khalida just shared with us, sort of to back up what we're learning from our community members and our stakeholders. So despite the fact that we did a community health needs assessment really in the height of the pandemic in 2021, we actually were able to collect over 6,300 community health surveys across our region. And so we got a valuable amount of information with those surveys. And of course, a lot of what we found reflected the impact of COVID. So where we didn't see reports of domestic violence and child abuse in 2018, we saw a lot of self-reported domestic violence and child abuse and food insecurity and housing insecurity. So it is a great tool. We partner with Carilion Clinic. They developed the tool back in 2012, and we have been sharing that tool with them since 2018, and it allows us to have a regional view beyond just our health system in terms of what we're finding. In 2021, we were not able to do target population focus groups because of COVID, and we just felt like trying to do a Zoom meeting was just not culturally sensitive to the populations that we're serving. And so instead we did do stakeholder focus groups with a lot of the key drivers and leaders in our communities. We had about 148 individuals who participated across our regions. And then again, as I mentioned earlier, we have community health assessment teams that oversee the entire process. As a matter of fact, Denny Huff is one of our chat members for the Bedford service area, and they really do drive the work that we do every 3 years. I'm not going to spend a lot of time on this slide, only to say that we love the county health rankings framework. Our needs assessments are designed to address the three main tenets of the county health rankings framework, which is looking at policies and programs that impact our health outcomes, looking at the health factors, the 4 categories, with a special emphasis on social and economic factors, health behaviors, clinical care, and physical environment. And then finally, we collect data and ask questions on our surveys, not only about health factors, but about health outcomes. For us, we use the county health rankings every year as sort of our community scorecard. And so we track how we're doing across the region, and we color code our communities based on whether they're doing great, which is green, yellow if not so great, and red where we really need to look at improvement. And so you can see much of our region is in the yellow or red area, and we are working really hard to try to move the needle on that. And we're starting to see some improvements just in 2020 in the latest data from 2022. The culmination of our assessments obviously are the prioritization of needs. We do a ranking, an objective ranking, where we take, again, a lot of the information that came out of our community health surveys and focus groups, and we have a scorecard, a ranking card that our community health assessment team members complete. And so I just wanted to share with you that these are the top 10 prioritized needs across our region. You'll notice, and I know it's not going to be a big surprise, that access to healthcare services and mental health and substance use disorders and access to services are clearly at the, in the top 5 across all of our regions. In addition, this year, or in 2021, as I mentioned earlier, issues impacting children and their families was not even a twinkle in our eye in 2018 in terms of need. And this year, across all 3 regions, it was ranked as number 3, both looking at child abuse and neglect and child care issues. If COVID did nothing else, it definitely shed a light on the need for childcare that went away for sure with a global pandemic. In addition, in 2021, aging and elder care bubbled to the top 10. We had not seen that before, and of course the social isolation that came along with the pandemic had a lot to do with that. And then most of the other priority areas are really focused on our social determinants of health. And so, we look at this as at the beginning of a roadmap for us and our community members. And we use this information to drive our work for the next 3 years. So we don't just assess, and I know I'm preaching to the choir here because all of you do this work, and the assessment feels like, at the end of the day, you finish your assessment, you take a deep breath and you go, oh, whew, thank goodness that is done. But the reality is the work just is beginning after a year of collecting data and planning and looking at need. And so, the next thing we have to do, and again, as an IRS requirement, but also because our health system is committed to this, is we create a plan on how we're going to address the needs as a health system, and then also look at what we can't address, but how are we going to continue to be involved so that we're not just looking at 2 or 3 priority areas, but we are involved across our system. So again, this comes from the IRS Federal Register, and just tells us that we must meet the needs. We must be able to describe how we're going to meet certain needs, and also how we're not going to meet need, at least from a hospital system perspective. So in 2022 and 2025, our 3 hospital systems, which includes Centra Bedford Memorial Hospital, which is headquartered in the town of Bedford, Centra Southside Community Hospital, which is headquartered in Farmville, and then our 2 flagship hospitals, Lynchburg General and Virginia Baptist Hospitals in Lynchburg. These are the priority areas that we developed our implementation plans and are now actually have activated those plans and are working on them. Across all three systems, we have to work on addressing access to healthcare services. Without a doubt, that is a role that we must play. Additionally, looking at mental health and substance use disorders and access to services, again, across all three regions, we're addressing that need. In our Bedford and Lynchburg areas, we are looking at issues impacting children and their families. And in the Farmville region, they're looking at how are we going to strengthen our coordination of resources and do community outreach. Additionally, in Lynchburg, they're also looking at the impact of chronic disease, not just on our patient population, but in the community. We have our implementation plans on our website as well, and you're welcome to go look at those, look at our strategies, and look at what we expect to accomplish in the next 3 years. We also are, as we developed our plans, and we had our executive leadership team and our executive leaders from all three of our hospital service areas develop a plan that took about 4 months for us to do. But one of the things, we decided to pull out some overarching themes. And one is that we could not deny that the impact of COVID-19 and the global pandemic will be with us for a long time. So as we're working on our plans and we're, activating strategies and all of that good stuff, we really can't forget the impact that COVID-19 has had on us, both as a community and as individuals. In addition, all of our plans have a focus on diversity, equity, and inclusion, and how can we be do more targeted interventions with that, using our data in particular. And then finally, focused on individuals who are either at risk for poverty or are living in poverty. We can't do this work without our community partners, and I can't stress that enough. And again, I know I'm preaching to the choir here, but we are so fortunate in our region to have partnerships and coalitions that are that stand, really side by side with us, and they participate in our community health needs assessments, and then they create regional health improvement plans. I would be remiss if I didn't mention that our departments of health, we have 3 health districts that are part of this work as well, and they are an integral part of what we do too. But we have, in the Bedford region, we have an organization called the Bedford Area Resource Council. It is addressing similar priority areas that we are addressing, and then some that are different as well. And we have Centra leadership on all of the subcommittees at the Bedford Area Resource Council, addressing some of the social determinants and other needs that they're working on. In Farmville, as a result of this last needs assessment, a newly formed network called the South Central Virginia Nonprofit Network, which is being led by their community action agency, Steps Incorporated, is working they're working on priority areas around food insecurity, housing and homelessness, and transportation. And again, a groundswell of community support and just some really great work going on there. In the Lynchburg region, we have a partnership called the Partnership for Healthy Communities that has a backbone of the Community Access Network, which is an FQHC lookalike here in Lynchburg. And they are, again, focused on 5 of the priority areas that were identified in our needs assessment. In addition to these wonderful resources, we also have our Centra caregivers and leaders on many of the boards across our region, or working with nonprofit organizations that are addressing some of the areas of need that we just were not able to do. In addition, our grants and our sponsorships fund a lot of those organizations too. So even though we might not be actively addressing transportation, we're supporting it on many different levels.
Pat, one question you have
Yes.
that dropped in the chat is, what kinds of qualitative methods do you use to synthesize and rank free text responses that are gathered? Or do you only rank the numerical survey responses?
No, we also do, we rank, obviously we do focus groups. So we code all of our qualitative responses in our focus groups. We code them by categories. And then we, to get into the nitty gritty of it, we code the responses, categorize them by, like as an example, I'll use this perhaps in Bedford, our focus groups, all of the responses dealt, and we have questions that we ask, obviously, focused on childcare, healthy aging, healthy foods, housing, mental health, and transportation. And then we look, not only do we look at, how we're going to code those responses by these different categories, but we also look at the percent of responses that we collect for each of these categories, so that we can start to prioritize. 50% of our stakeholders said childcare was an issue, where only 5% said transportation was. So that's a really important part of our work, and we do see value in that. We're also very lucky in the Lynchburg region in particular, well, actually across our region, we have several academic institutions that are working with us to help us better quantify our data, and also help us start looking at statistical significance with the work that we're doing.
Great.
So, and that was my last slide. So
timed it
yeah,
perfect.
so that was perfect timing on the question. And I really thank you all for the opportunity to be here. I think across the state of Virginia, we're all in the same boat, and it's wonderful to be able to talk to groups that are serving the Commonwealth. And again, I'm really excited about the fact that we have a shared database now that we can all use together. So thank you again for